Good afternoon, everyone. I'd like to take this opportunity to welcome everyone to the House Economic Matters Committee. Today is Tuesday, February 23rd, 2021. We have 7 bills before us today. The first will be by Delegate Weigel, House Bill 1105. Just a couple of quick housekeeping messages. We have, after the sponsor introduces the bill, the witnesses have 2 minutes to testify. The chat, I would say to all of our guests, it's strictly for the members and staff to communicate to one another. It's not to provide additional information when you hear something that you agree with or don't disagree with. It's strictly for the members. With that, we will get started. Delegate Weigel.
Thank you, Chairman Davis. Vice Chair.
Are you there?
May and honorable members of Economic Matters. I know economic state. Yeah, can you hear me?
No, we're having trouble. Are you connected to the line, or are you trying to do this wireless? Hello? Are you with us, Delegate? All right, let me give him just a minute to see if we can correct this. If not, we may need to come back to the delegate. All right, we're gonna go, Delegate Carey, can you take us to House Bill 1138?
Yes, sir, Mr. Chairman. And before we get started, before I present the bills, I just want to preface it by saying that I'm presenting 5 bills today that address the unemployment division in the Department of Labor. And, you know, as you mentioned yesterday, Mr. Chair, that these bills was a compilation of our work groups, meetings with the Department of Labor, businesses, claimants, individual legislators, and leadership. And I would just point out to everybody that these issues are very complex, and we have a lot of ground to cover. And for today, I would just say that it's just myself and Ms. Patrice Drago. She won't be testifying, but we'll be working in tandem, if that's okay, to answer questions as they come up through all of these bills. So with that, I'll lead off with House Bill 1138, which is accountability and oversight. And as I mentioned, you know, this past year brought to light a lot of serious gaps in the performance of the unemployment division. Clearly, the extreme increase in the claims due to layoffs and furloughs for an extended period of time was just really a lot to manage. So what House Bill 1138 is designed to do is to provide transparency and accountability to give the people of Maryland the information that they need on an ongoing basis. And it also establishes a disaster recovery plan for the unemployment division to be activated when there is some sort of disaster. As I said, this bill has 2 components. First, there is a monthly reporting component to the presiding officers, the Senate Finance Committee, and the House Economic Matters Committee that include the balance sheets from the Unemployment Insurance Trust Fund, the number of open claims, claims pending adjudication, and the total claims closed. And this is designed to be done on a monthly basis. We're also going to be requesting an amendment to expand the weekly reporting that's available through the department's website. We would like to have them put it on their website to include the number of open claims, the number of claims that have been unresolved for more than 21 days, and the number of claims closed. And as I said, the second part of this bill is a disaster recovery plan. In that, we've set up what would be triggers that would activate a disaster recovery plan. And there should be an attached amendment that basically says, has updated language that says the trigger for a disaster recovery plan is if there's a 6% increase in unemployment claims for a sustained 4-week period. So the disaster plan would begin in week 5. And then to end the disaster, it would be the plan would stay active until all the claims were resolved within timeframes that are set within federal guidelines, which is 87% of claims resolved within 21 days. And what this plan does, it creates accountability through reporting. So the disaster recovery plan, we hope, would enable the division to respond quickly and with autonomy in order to minimize potential negative impacts of the increased claims. So the department would issue a disaster report to the presiding officers, again, the Senate Finance and House Economic Matters Committees, within 7 days of the determination of a disaster, and then would provide a report every 30 days during the disaster. And the report would include the department's plan for navigating the disaster. We want to know what anticipated staffing needs over 30, 60, 90 days and their plan to meet those needs, because we did hear a lot about that, all of us, in our discussions with them this summer. The unemployment insurance trust fund balance before the disaster began and its current balances as we proceed through, an update on the federal administration and support. Also, another part of this would exempt the department from requirements under the state financing and procurement articles for staffing. So if they need to hire staff, they would be able to have emergency procurement powers to go ahead and get the staff that they need. So we all hope that we never have to experience this type of devastation to the workforce again, whether a pandemic or a severe economic downturn or any other unforeseen circumstance. But we believe by having this disaster recovery plan and contingencies in place will make the difference between temporary discomfort and long-term devastation. So I think this bill will help establish the framework for preparedness in the face of a future disaster. So I would urge a favorable report on House Bill 1138. I'd take any questions. And like I said, Ms. Patrice Drago, my chief of staff, who really is who's been working this very hard for us, is also here with me to answer any other questions we might have.
Any questions of Delegate Carey? Seeing none. Thank you very much. Is Delegate Weibel with us?
I am. Can you hear me now?
Yes, let's give it a shot.
I apologize. I was connected, and then when I started my presentation, I lost the connection somehow. Anyhow, if you allow me, I'll start over to introduce House Bill 1105.
Yes, sir.
Honorable Chairman Davis, Vice Chair DeMay, and members of the Economic Matters Committee, I'm pleased to present you with House Bill 1105. I know that the issue addressed by this bill is not new either to the legislature or to your committee, as the governor included it in part in his economic stimulus bill. This bill is different in somewhat, though, in that it would prevent the unemployment rate from being changed at any time that a business ceases operations for reasons beyond its control, and mainly that of government shutdown. So it not only looks at a point in time, but it looks at any time as a rush.
Delegate Weibel, I don't know if you can hear me, but we can't hear you unless it's just me. Can the rest of you all hear the delegate? Okay, so it's not just me. You want to try it again? You there, delegate?
I unfortunately can hear you fine.
Okay.
Yes. Here we go again.
All right. Go on, you have the floor.
Can you hear me or not?
Yes.
So do you want me to start over?
No.
This,
Just
you
pick
know, I
up right
love
where you left off.
Zoom and I love technology. If only we could get it to work. I'm not, did you hear anything at all or not?
Yes, do this, Delegate Weibel. Stop your video, and then I think you were about a quarter of the way through when you went out. So it was right around where I think you said the governor had put it in his bill, but you wanted to do this anytime there was, I guess, a stoppage. That's sort of where you went out.
Okay. All right, so this bill is a little different from what the governor had in his bill, in that it's not specific to the pandemic or specific to any point in time. Anytime in the future that a business would be forced to close as a result of government action, the employer's rate could not be adjusted because of that action beyond his control.
Okay. Are you done?
Yes, I asked for a favorable report. I don't know if you can hear me or not. It's very frustrating.
No, we got you. Are there any questions of the delegate? Seeing none, thank you very much. And that concludes our hearing on House Bill 1105. Let's go back to Delegate for House Bill 1139 now.
Thank you, Mr. Chairman. Mr. Chairman, Madam Vice Chair, members of the committee, for the record, I'm Delegate Ned Carey. House Bill 1139 is designed to raise the amount of income that can be disregarded and not deducted from a claimant's unemployment benefits during the duration of this state of emergency. The current income disregard in Maryland is $50 per week, which means the first $50 in earnings will not be deducted from your unemployment insurance benefits, but any amount over $50 a week is deducted from a claimant's benefit payment on a dollar for dollar basis. And I would just point out that unemployment benefits are designed to be short-term. The average length is 16 weeks, although it's been longer. But we have claimants out there who are holding off creditors, who going without and still finding themselves facing potential evictions, car repossessions, utility shutoffs, you know, as these moratoriums come to a close. So in normal times, many claimants work both full-time and part-time job to make ends meet. This bill would raise the amount that would be disregarded from $50 to $300, as I said, until the end of the state of emergency. I think that it's necessary to keep Maryland workers from finding themselves in debt that could be insurmountable, and we'll provide some temporary relief necessary while they await the promise of the full-time employment and, in some cases, second jobs. Once things return to normal, the income disregard would return to its pre-pandemic level, and you'll hear later on about our reform study, the bill that we have. And what we would do is we would study what the income disregard might be, if at all, in that bill. So right now, we need to give hope to Maryland workers who've been impacted by the loss of employment due to COVID-19. I believe the passage of this bill will help them see the light at the end of a very dark tunnel. For these reasons, I would ask for a favorable report on House Bill 1139. there any questions?
Are there any questions of the sponsor? If not, thank you very much. Let's go to House Bill 1143.
Okay. Right, House Bill 1143 is work sharing. This is another emergency bill that we believe will help Maryland workers and Maryland businesses while they work to hold on now and then try to climb out of the impact of COVID-19 that we've had on our employers and our employees. What this bill will do, this bill will expand the existing Department of Labor's work share program and create more visibility and understanding of the value for employers. You know, the work share program exists today, and it's currently a voluntary program that provides alternatives to layoffs for employers faced with a temporary non-cyclical decline in business due to lower economic activity. The program's designed to avoid layoffs by preserving jobs for current employees and to assist businesses that have already undertaken layoffs to reopen and resume operations gradually. Employers who participate in the work sharing program can retain employees by temporarily reducing the hours of work, allowing the employees to receive partial unemployment insurance benefits to supplement lost wages. So House Bill 1143 will expand the flexibility of the program, allowing it to be used as a rehiring tool for businesses as they open and recover from COVID-19 pandemic. Unlike regular UI, the work share program right now is 100% reimbursed by the federal government due to the provisions of the CARES Act. But this bill specifically does the following. It expands the allowable reduction in hours eligible under the work share program from 20% to 50% to the maximum federal allowable 10 to 60%. It also expands the eligibility of the program to paid internships and apprentices. It also expands the program to individuals rehired following a temporary closure or layoff due to the COVID-19 pandemic. The other thing it does is it sets a goal of trying to achieve a 4% work sharing claims as a percentage of the total unemployment claims by June 1st. And it requires the department to ensure sufficient staffing and resources to process the work sharing applications within 10 days. Really what we've seen is the work share program hasn't really been promoted to employers. And that's what we're trying to do with this bill, is to let the employers know that this program is out there and available to us. As a matter of fact, the Relief Act provided money for the for this work share program to do just that. So, you know, after COVID-19, when the provisions of the CARES Act requiring the federal government to provide 100% reimbursement for the work share claims expires, this legislation will make the work share program more of an effective alternative to layoffs and would really have a negligible impact on the trust fund. So it's for these reasons I strongly urge a favorable report on House Bill 1143.
Any questions? Not. Antonio Santoro.
Yes, sir. Hello, I would like to thank everyone for allowing me to advocate today. As mentioned, my name is Antonio Santoro. I am a second year's master's student pursuing a dual degree in social work and public policy. I was a participant in the policy hackathon and was a member of the Workforce Development Committee. I am advocating today on behalf of House Bill 1143 as it expands Maryland's capacity to provide aid to its labor market. Okun's economic law states that when GDP decreases, the unemployment rate increases. Throughout Maryland, businesses have experienced a shock in revenue due to COVID. As a result, according to the U.S. Bureau of Labor Statistics, the unemployment rate in Maryland is 6.3%. The work-share program has the propensity to negate Okun's law, as businesses will have the ability to preserve the jobs of employees during periods of economic crisis. Ultimately, I believe it is vital that Maryland's workforce remain active and constantly developing. Therefore, as a Marylander, I advocate for HB 1143.
Any questions? Seeing none, thank you very much. House Bill 908.
Thank you, Mr. Chairman, Madam Vice Chair, members of the committee. House Bill 908. Just take a second here. This is employer contributions. These are payment plans. So as we've been talking about these other bills, House Bill 908 would require the Maryland Department of Labor to offer employers another mechanism to mitigate the high impact of unemployment taxes on their recovery by offering a variety of flexible payment plans for their unemployment taxes. What this legislation does is codifies the current practice of working with employers by offering payment plans, too many P's, when in Table F. But it also requires the department to be more flexible with employers by creating individual plans. So under the current law, the Department of Labor is required to adopt regulations for payment plans when we're in Table F. And while there are payment plans currently available, there are no regulations in place. This bill would provide for them to put the regulations in place. The other part to this bill is we go one step further and say, regardless of what table we're in, we would like the department will offer payment plans to businesses irregardless of what table that we're in. And, you know, we think having a plan that works for the businesses will allow them to focus more on recovery efforts and less on worrying about paying their unemployment taxes up front as we continue to work out of the COVID-19 pandemic, and then enabling businesses to have payment plans available no matter what table we're in. If a business should be subjected to a small downturn, they can go to the Department of Labor and work out a payment plan that can help them moving along and moving forward. Again, this is a pretty simple bill that will not impact the trust fund, and it will help get employers back on their feet. For those reasons, I strongly encourage a favorable report on House Bill 908.
Questions? If not, let's go to House Bill 907.
Thank you, Mr. Chairman, Madam Vice Chair, members of the committee. House Bill 907. This is a study on the system reform. As our work group, as we worked through all this, you know, we realized that we needed to take a look at the entire system to see if any reforms would be needed to kind of, as I joked, to bring us from at least the 20th century into the 21st century. But, you know, as I've said, clearly the COVID-19 pandemic has revealed weaknesses in our current UI program. And we've received complaints from all over the state on the effectiveness of the program. So as I said, over the past 6 to 8 months, our goal has been to look at all of the things that we felt needed to be considered in order to try and improve the unemployment insurance program. We've had to parse them out into those things that needed to be addressed immediately and those that require more information to determine the feasibility and correct approach, particularly when impacting the health of the trust fund. As I said, the other legislation, 1138, addresses the department's programmatic delays by requiring a disaster recovery plan. But House Bill 907 includes the items that need to be examined, and it will require DOL to work with DLS to study and make recommendations on the costs and benefits of those reforms. During the study period, the department will provide the General Assembly with monthly status updates. An interim report is required on July 1st and a final report December 1st. And in this bill, we're asking the department to look at the following: expanded eligibility for various types of workers, including self-employed workers, gig workers, those kinds of employment, the costs and benefits of raising the weekly benefit amount, including indexing the amount to inflation, the costs and benefits of increasing the dependent allowance, cost and benefit increases in the income disregard, as I said before, alternative approaches to the experience rating process. And I would just say this to you, my colleagues, if you guys have any ideas or thoughts about other things, please feel free to share those with me. It would certainly be appreciated. But as I've said before, the UI program is very complex, with one change potentially having an impact on the entire system. So each of these study topics will ensure that we find the right balance of providing appropriate relief to claimants and stability for employers. We must be good fiscal stewards of the trust fund, and we have to ensure that the funds remain solvent without putting undue burden on the businesses who pay the unemployment taxes. So this study will go a long way in ensuring that we have the best information available to make crucial changes in the future. And for those reasons, I urge your favorable report on House Bill 907.
You're muted, Mr. Chair.
Thank you. Hearing none, final bill of the day, House Bill 1002, Delegate Charkoudian.
Thank you, Mr. Chair and Vice Chair, colleagues. For the record, Delegate Lord Charkoudian speaking here in favor of House Bill 1002. So this is a comprehensive unemployment insurance bill. A handful of these topics overlap with some of Delegate Carey's bill. We're working together to make sure that we have coordination on that, and we'll fix that. But a lot of the issues here we haven't talked about yet this afternoon. I feel like from my testimony, what I want to tell you is see your email inbox, call logs, and talk to your staffs for the last 9 months, because the reality is I know that all of us are very familiar with the fact that we have had a broken unemployment insurance system, that our constituents are calling us, begging us, sobbing to us, threatening us, devastated, desperate, and don't know how they're going to get through the next couple of weeks, don't know how they're going to pay their rent, their food, their prescriptions, really seriously struggling, and our system for the most part has failed them. This has been a problem for individuals in our community, but it's also a problem when we don't have an effective and an efficient unemployment insurance system. It's a problem for our entire economy. The macroeconomic value to an unemployment insurance system is that it is countercyclical. And so at the very time when the economy is struggling the most, it's putting money into the economy to lift up and support a level of stability within the economy. So it's crucial both for the individuals as well as for the economy as a whole that we have an efficient and effective unemployment insurance system. I want to say that I think that we would have had challenges regardless. Certainly every state in the country had some challenges, but I think that the challenges that we had in this state were unacceptable, were avoidable, and frankly are still happening to this day. I still have people calling me. I still have people struggling, receiving bills for overpayment with no explanation and no way to get out of the situation. Overpayment that's way more than they ever even received. Mistakes caused by the Department of Labor that they're now stuck with trying to fix. And so my bill does a number of things, and I want to walk through the different sections of it. There's portions of the bill that wouldn't require legislation to be done, but I'm putting them in legislation because I believe we have all asked the Department of Labor to do these things over the last 9 months, and they've chosen not to. And so these things fall under the general area of being able to connect with a human being at some point to ask questions. And so this is folks who are overwhelmed, confused, stuck, and struggling, and can't find their way through the answers on Beacon and need to be able to speak to a human being. There's pieces of this bill that are about clarity on the website, clarity in communication, translation and interpretation services. documents that people can get their hands on. There's problems about beacon between a cell phone, beacon on your phone versus beacon on the computer, being able to actually get documents that folks can engage with in a timely fashion so they don't miss appeals deadlines. There's issues that are, there's components of the bill that address the choice of the payment forms legally, federally. People have a right to a paper check, but it's impossible the way the system is currently set up in Maryland, unless you actually speak to a person to find out how to switch from a debit card to a paper check, if that's what you prefer. There's pieces in this bill that are about increasing staff in response to a crisis and ramping that up quickly, not waiting 6 months, hiring some more people, waiting another 6 months, hiring some more people. There's pieces that are about ongoing investment in the system to make sure that we're ready for crises when they come. So all of these things could be done, I think, without a bill, but since they haven't been done, we're here with this bill. Then there's other things that are new. There are things that require additional legislation, and so this is our opportunity to put those into place. So we have here is higher standards for completion of claims, both completion of the initial claim and for a new standard for completion of claims that require adjudication. We have a goal for a recipiency rate. So this tells us we know how many people are unemployed. We want to make sure that the vast majority of folks who are unemployed are receiving unemployment insurance, again, for the reasons that I described earlier. And this bill requires that the Department of Labor establish a goal for a recipiency rate and then report regularly on how they're meeting that goal. There's issues in this bill, and there's additional amendments coming that will address the overpayment issue. I assume that many of you have heard about the overpayment issue, where folks end up with overpayment bills. There's nothing on that overpayment statement that tells them what it's from. Sometimes they receive overpayment statements that are more than they ever received. There's a very tight window to appeal those overpayment statements. And it's a very confusing and convoluted process that leaves our constituents stuck potentially also with credit score issues that could last them for many, many years. And then my bill also addresses the minimum disregard. Delegate Carey talked about the importance of addressing the minimum disregard. The bill that I have makes that same change, but makes it permanent. It's a way of supporting people who work multiple jobs to not be penalized essentially for keeping that second job. Right now, in essence, people who need both jobs lose one and either are incentivized to quit that second job or are penalized for having that second job by losing the funds on the first job, the unemployment for that first job. Finally, a really significant and important piece that you're going to hear more about from some experts shortly is the connection to health insurance. One of the things that we know is that a lot of people have their health insurance through their employer, and so when they lose their employment, they often have also lost their health insurance. There are systems and programs in Maryland that could probably, in a lot of these cases, insure these same folks either for a free or subsidized program, but people don't necessarily know how to connect with that. And at a time where they're feeling overwhelmed by the economic situation, they may not go hunting for how do they get health insurance for themselves and their families. So this bill makes an automatic connection between the Department of Labor's system and the Maryland Health Benefits Exchange, where people have a chance to indicate that they're interested in finding out more about what they may be eligible for, and then they are connected and hopefully enrolled. You'll hear more from some of the panel about that piece of the bill. In terms of supporting small businesses, I have a section in there that freezes the experience rating. We've heard a little bit about that. The relief bill that we just passed to some extent addresses that. I'm working with staff to see how the component in my bill supplements and supports small businesses in addition to what we have in the Relief Act. And then the bill in front of you, 1002, also studies a number of issues that have come up over the last several months. And again, I'm working with Delegate Carey. Some of the pieces in the study bill that I have, the study section of my bill, are already in his bill and some are not. And so we'll make sure that whichever bills move, we'll make sure that all the issues that have come up get studied. And I just want to close by saying, I think throughout this pandemic, people have asked us what we would do, what our offices can do to fix this mess. And we've had to say, really the Department of Labor is under the governor, and we've done everything we could to advocate for individual constituents with their issues. But now we have this opportunity to really take concrete legislative action, and I hope that you'll join me in doing so. Mr. Chair, I'll take questions, or if you want, we can hear from some of the panel members, and then I can take questions along with them.
Yeah, let's do that. Let's go to some of the witnesses and we'll see if any questions arise during their testimony. The first up is Zinga Hooker, National Employment Law Project.
Yes, good afternoon. Thank you, Committee Chair Davis, Vice Chair Dumays, and members of the committee for allowing me to testify on this important matter today. My name is Nzinga Hooker, and I'm a staff attorney with the National Employment Law Project, also known as NELP, and I'm testifying in support of House Bill 1002. Our primary goals at NELP are to build worker power, dismantle structural racism, and ensure economic security for all. The need for a better system was apparent even before the COVID-19 pandemic, but this unemployment crisis has further illuminated the challenges with the existing UI infrastructure and presented an opportunity for UI reform. Maryland's UI system has been severely overwhelmed by the influx of benefits applications. Based on the latest reported data on Maryland's timeliness rate, Maryland is one of the lowest in the country, with only 37.5% of payments going out within 3 weeks. This is well below the federal standard. More can and must be done so that workers do not continue to suffer due to the inadequacy of the state's UI system. This bill also addresses sufficiency of UI benefits for part-time workers. The bill would increase the income disregard so that more Marylanders who work part-time can still receive unemployment benefits. The share of employee workers who work part-time in the US, either because hours were reduced by their employer or they couldn't find full-time work, exceeded 6 million 6 years ago. That share of workers has only increased. Recent data from January 2021 shows that about 24.67 million people were employed on a part-time basis in the US. This is a necessary change where so many people work part-time. There are a number of states with more generous partial UI benefits than Maryland, and those states have been able to structure their UI system to account for a higher income disregard. When structured properly, partial UI benefits encourage claimants to work part-time while they continue searching for a permanent full-time replacement. If they accept part-time work, claimants receive lower benefit payments in combination with their earnings, thereby reducing UI benefits payments. As Maryland works to address UI access and sufficiency issues and the number of unresolved benefits plaguing the system, the passing of this bill will be a critical start. In the written testimony that I submitted, I included recommendations that NELP has made about modernizing and reforming state UI system in a way that centers the experiences of Black workers, Latinx workers, and other workers of color. And I linked to a report on centering workers, how to modernize unemployment insurance technology. Thank you again to the committee for this opportunity to testify today and for your consideration of this really important legislation.
Thank you. Brig DeMay.
Good afternoon, Mr. Chair and members of the committee. My name is Bridge Dumay, and I'm a political organizer with 1199 SEIU, the largest healthcare workers union in the nation. We represent 10,000 essential healthcare workers in Maryland. 300,000 Marylanders don't have health insurance during COVID-19, so we support HB 1002 to increase the number of insured Marylanders. HB 1002 is a critical step for our members to remain healthy. By allowing more people to qualify for free or reduced cost health insurance, we can ensure that people who need health care don't avoid seeking care because they can't afford it. Consequently, this bill will prevent unneeded medical costs to the state, reduce premature deaths, and lessen the burden of medical debt, all while giving better access to affordable health insurance and fostering a healthier workforce. COVID-19 has infected over 373,000 Marylanders, making access to health insurance more crucial than ever before. Black and Brown Marylanders are disproportionately impacted by COVID-19 because they experience higher rates of healthcare disparities like chronic diseases, unaffordable healthcare, and medical debt. This bill can reduce the number of overall racial and economic health disparities by making it easier to get health insurance coverage for those who need it the most. Since many Marylanders can only afford health insurance for themselves and their families through employment, unemployment leads to an increase in medical costs, debt, and even death. HB 1002 allows people to continue to support their family's health regardless of their employment status. Everyone, employed or not, deserves the right to affordable health care, and this bill can help achieve that by creating a necessary structure to improve overall health insurance equity for Marylanders. We ask for a favorable report on HB 1002. Thank you.
Thank you. Stan Dorn.
Good afternoon, Mr. Chairman, Madam Vice Chair. Thank you for the opportunity to testify today in strong support of House Bill 10-2. Families USA is one of the nation's leading health consumer advocacy groups, a nonpartisan organization whose mission is to make sure that everyone in America gets the health and health care they need to thrive. And this legislation would take important steps in that direction, helping nearly 150,000 Maryland residents who rely on unemployment insurance to make ends meet but have no health insurance. Its approach was originally developed by the woman who is now President Biden's chief healthcare advisor, and it builds on successful initiatives in Kentucky and right here in Maryland. Last year, Kentucky made health policy history when the Unemployment Insurance Agency in that state gave the Medicaid agency contact information for all UI claimants. The Medicaid agency sent them emails urging them to apply for health coverage. And when people opened the emails but did not complete all the paperwork, the Medicaid program called them on the phone, signed them up over the phone, and more than 130,000 people got health care, the most successful Medicaid enrollment initiative in the country. Right here in Maryland, you passed the easy enrollment legislation in 2019, which has likewise been extraordinarily successful. It lets people begin their application for health coverage by checking a box on their tax return, asking to have the information shared with the health insurance exchange. Even though we are just in phase one implementing easy enrollment, which is a direct mail campaign, essentially, the legislation has had amazing success. The most effective direct mail campaign in history aimed at health insurance was done by the Internal Revenue Service during the Obama administration. They achieved a 1% take-up rate. They saved lives. There was a statistically significant impact on mortality at a 1% take-up rate. Here in Maryland, we've achieved more than a 7% take-up rate. I've been doing this work for 35 years, never seen anything like it, and that's just phase one. When we get to phase two, where enrollment becomes electronic and real-time, Katie bar the door. I am so proud to be a state resident here in Maryland, and by passing this important piece of legislation, you all will continue to be engaging in common sense, bipartisan measures to make sure that everybody in this state gets the health care they need.
Charles Thomas. Is Charles Thomas with us? Andy Spicer.
Thank you, Mr. Chairman and Madam Vice Chairman. I appreciate the opportunity to speak to you today. I'm a claimant in the unemployment system. I own a company that does electrical engineering and computer software development that pretty much lost its entire client base when COVID pandemic hit. And I've been out of work since March or so. I filed in April and everything went fine until July. And when all of a sudden my weekly payments just stopped. And I have been trying to deal with that ever since. And I thought I could give you a perspective that I think is important on what it's like to interact with the system. So in the beginning, I have called every week, by the way, since that date, which amounts to about 43 completed calls over that time period. And it was difficult in the beginning to get through, 22, 23, 24 calls, attempts before you get through. It is much harder now. It takes days. But the big problem that I've run into along the way is a complete lack of transparency in terms of what's going on. I have no visibility into anything. And progressively, as the years gone on, the people that are answering the phones are not able to deal with issues. They essentially are just placating the people. They've been terrific. I have to say, the agents that answer the phones just across the board have been great, but they don't have the ability to make changes or to fix things. And I added the hours up because I kept track of all my calls. I've spent over 43 hours on the phone with an agent since July. That's an entire week of a person's time that was completely wasted. And the only way that that is going to change is by there being some sort of visibility into that process. I didn't need to talk to them 43 times. I only needed to talk to them once and be put in a queue somewhere that I could follow and see progress on. If it was going to take 3 months, that's fine. I could have planned around that. But this calling every week and being told things are going to happen and not having them happen is debilitating, to say the least. And what I would encourage you in these bills, and specifically in support of HB 1002, is to insist on that transparency and accountability. It does not exist today. Thank you.
Thank you. Camelia Guerrero.
Hi, my name is Camila Guerrero. I am a constituent of Delegate Lorig's, and I was on unemployment insurance for a couple of months starting back in April. And I had a lot of difficulties starting in October when I got a notification saying that I had been overpaid for my unemployment insurance, and I owed the government, I think, around $5,000 to $6,000. I had no idea how it happened. And when I was looking through all of the documents that I had submitted to Beacon, nothing really made sense. I had uploaded all of my W-2s. Everything was documented. Nothing should have gone wrong. But for some reason, there was a revision in my weekly the weekly amount of money that I was receiving every week, and they changed it and reduced it to only account for part of my salary from 2019. And I couldn't get answers from anybody. I tried to call the Department of Labor, but I never talked to a human being. It was really, really difficult to get to anybody. So then I ended up contacting Delegate Lorig to try and get some help with that. And right now, I still currently owe the government around, I think, $3,000 or $4,000 because they started to take money every week from my weekly allowance, and it's currently still not resolved. It's still just being investigated. But I wish that there was more transparency as far as what was going on and what went wrong, because it really still doesn't make any sense to me. And I'm in favor of this bill.
Thank you very much. Vincent DeMarco.
Thank you, Mr. Chairman and Madam Vice Chair. Appreciate this opportunity very much. Maryland Healthcare for All Coalition thanks Delegate Charkoudian for adding the healthcare provision to otherwise very necessary HB 1002. As you heard so eloquently from Families USA and 1199, this is very, very important. There are tens of thousands of Marylanders eligible for free or low-cost healthcare who don't know how to enroll in it. And getting them enrolled is an equity issue. Many of them are people of color, disadvantaged folks. We need to help them get enrolled. And you took a big step in that direction. As Stan Doran said, with the easy enrollment law of 2019, over 50,000 Marylanders checked the box that they wanted to be connected with healthcare when they filed their taxes. Many thousands of them got enrolled, including children. A great success. Now we can build on that success with this connection between people filing for unemployment and healthcare. We know it's a good way to catch a lot of people who don't know that they can get access to healthcare. In my testimony, I submitted results of a focus group where we talked with people who had no health insurance but were eligible for low-cost healthcare. We talked about this program, and this is what they said. They have to go big with this because people need this. Where are they hanging out, people? They're hanging out at the unemployment office. That's where you need to find them. That's what the folks in our focus group said. We believe that through this provision and Delegate Charkoudian's legislation, we could find even more thousands of Marylanders who are eligible for free or low-cost health care and get them enrolled. And they and their families will be greatly helped. But we will all be greatly helped because the more people get health care coverage, the less uncompensated health care there is, which brings up all of our premiums. House Bill 10002 is a big win for Marylanders, low-income Marylanders, all Marylanders. We urge you to give it a favorable report. Thank you very, very much.
Thank you. The final witness, it's actually not a name, it's an organization, Maryland Legal Aid. Is someone here representing the organization?
Yes, that would be me. Can you hear me?
Yes.
All right,
Can I get your name, please?
my name is Cornelia Bright Gordon. I am the Director of Advocacy for Administrative Law at Maryland Legal Aid. Legal Aid is a private nonprofit law firm that provides free civil legal services to low-income Marylanders. We have extensive experience handling public benefit matters, including issues related to unemployment benefits. I'm testifying at the request of Delegate Lorik Charkoudian, and Maryland Legal Aid strongly supports House Bill 1002 and asks that this committee give it a favorable report. I'll be focusing my remarks on the notices that your constituents receive and the reasons why they are so incredibly frustrated. The struggle of unemployed Maryland residents during this pandemic is exacerbated by massive systemic problems with the administration of unemployment benefits by the Maryland Department of Labor. House Bill 1002 will ease this burden by requiring the agency to establish standards and systems for timely processing of claims. The bill will permit people to track the status of their claims and the anticipated timeline for resolution. The bill requires the agency to provide clear notices related to overpayment, as well as an opportunity to engage with the health benefit exchange. We will be suggesting limited amendments relating to paper notices, appeal rights, and document translation. I want you to know that the department relies heavily on the web portal Beacon 2.0 as its primary interface. Also, the department has created a mobile app called the Beacon app, but the mobile app has very limited functionality. This is very problematic for low-income, disabled, and older adult populations because many of my clients do not have computers or laptops. So they cannot even apply for unemployment unless they can get someone on the telephone because they can't use their cell phone. They also can't look at their notices from the agency on the cell phone. Therefore, our clients frequently miss agency notices and then suffer a concomitant loss of benefits. This is completely unacceptable. It's based on notices only. Many older adults are not adept at internet programs and have great difficulty accessing Beacon and their notices. They're losing benefits because they cannot access the agency portal. Now, translation of documents is a bedrock requirement of all Maryland agencies under federal civil rights law, and we're going to be recommending an amendment relating to translation of documents. Also, Beacon and the telephone systems are problematic for people that speak languages other than English or Spanish. The general hotline prompts are only available in English or Spanish and do not notify callers that telephonic interpretation is even available. Callers who speak languages other than Spanish or English must access an English-speaking agent on the telephone system and then communicate that request for an interpreter. On the other hand, Beacon, remember, Beacon is the only way that most people can apply. But on the other hand, Beacon has zero language access service other than English or Spanish. It cannot be used by individuals that speak any other language. Consequently, in order to file an unemployment application, a limited English-speaking person has to access someone on the telephone. You've heard, I'm sure, many times how difficult it is to reach the unemployment agents on the telephone. House Bill 1002 will enact provisions that eliminate these barriers and, just as importantly, will provide transparency to the process. Now, I'd like to emphasize one last thing, if you don't mind. We recommend that the bill be amended to include a provision for that all adverse agency actions, including notices of overpayment, receive appeal rights. I cannot tell you how many of my clients have received overpayment assessments, and even with the service of attorneys, they're not able to understand why they have received one, or even file an appeal related to it. I have clients whose benefits were entirely stopped or significantly reduced because of an overpayment. And also I have clients that we negotiated benefits for, but their benefits were stopped and reduced by thousands of dollars without written notice or explanation, or an opportunity to file an appeal. The agency summarily rejects appeals filed by clients and by counsel.
Ms. Gordon, you've gone way over your time. I need you to bring it to a close, please.
Thank you. We strongly support the bill, and we ask that the committee give it a favorable report.
Thank you. Delegate Impalaria.
Yeah, so Mr. DeMarco's back. My question's for him. He said that if we look deeper and harder, we'll find even more people that we can give free health care to. And I have a problem with that word, free health care. Who's paying for the free health care? How does that get paid for? And if we add even more people, if we go looking for people, how do we do that? And how do we pay for all that free health care? Is that the taxpayers that pay for it, the businesses pay for it? Who pays for that?
Well, the fact of the matter, Delegate, is that we always pay for health care. When people are uninsured and they get very sick, they go to the hospitals and we don't turn them away. They get provided hospitalization, and that uncompensated hospital care puts all of pressure on all of our premiums. It causes all of our health insurance premiums to go up. We made a decision in Maryland when we expanded Medicaid pursuant to the Affordable Care Act that we were going to deal with that problem by making sure people who can't afford private insurance have Medicaid coverage, and therefore that Medicaid coverage will cover them and we won't have uncompensated hospitalization. And the Medicaid coverage is paid for primarily by the federal government, with part by the state government, and then above the Medicaid level, people get subsidies from the Affordable Care Act. So the fact of the matter is we've made a decision in Maryland, which I think is the right decision, that it's better to get people covered, to give them the health care they need, and to make sure that there's no uncompensated care that's zooming up all of our premiums. And we believe the more people who are eligible for free or low-cost health care who get it, the better it is for them and for all of us.
If I could add to...
Well, no, that's all right. I just need to one. So
Sure.
short, what you're saying is the taxpayers pay it through their federal taxes and the state taxes. So the more people that's on it, the higher our taxes are going to be. So that's the simple answer. If we're asking who's paying for it, it's actually the taxpayer. There's no golden tree out in the federal government or out at state government. We go pull this money off and it's free. It's paid for by the taxpayers. And so thank you for that answer.
Would it be all right if I added a little bit?
Right. No, we're good. I don't want to belabor it. Thank you.
Delegate Shi.
Thank you, Mr. Chair. I'll save other questions later, but for now, I just want to give a shout out to Ms. Gordon, and I want to commend her for speaking out. It was really a breath of fresh air to focus on this issue, which is Maryland's super diversity linguistically and culturally. And the federal law does have a stipulation regarding to LEP, limited English proficiency, an area that I focused on for years when I was working in Montgomery County, partly because I speak English as a second language. And the sheer volume that our office has received from people who speak all kinds of languages, on top of their frustration of not getting through to a human connection, was just compounding the inefficiency because of lack of government cultural competency. So I think this is actually a critical issue. Many agencies say, oh, it's an unfunded mandate, or say we don't have the ability to do that, but it actually improves our operational efficiency if we could be more mindful of the linguistic diversity and looking into how we can be in compliance. And some of the forms that are downloadable can easily be translated into different languages. That could actually save a lot of human resources on the front end. So I really want to just thank you for highlighting this issue. We need to go beyond just English and Spanish. Thank you.
Any additional questions? If not, thank you very much. That concludes our bill hearing for House Bill 1002. That concludes the bill hearings for today. I want to thank all of our witnesses and the bill sponsors for bringing the bills before us. And we will continue our work on these and the other bills that were on the calendar at a later date. Thank you all very much and have a good evening.
I guess we need to sign